Hello and welcome to our poster. We are a research group from the Catholic University of Croatia. The primary aim of the research group is throughout activities contribute to the responsible innovation, development and implementation of digital technologies in healthcare. From the June to December of 2021, we conduct interviews with the patient, physicians, IT engineers, lawyers, hospital directors, and public policy makers. And the aim was to describe and better understand the social and ethical challenges identified by stakeholders in the Croatian health system. Research protocol was enriched with two imaginary scenarios because of participants' diverse backgrounds. The two imaginary scenarios we present here are the work of a member of the Digit Heal project team. The scripts were presented in graphic and written form to the research participants during the interviews. The first scenario focused on the physician's skills and the relationship between the physician and the patient. The story is set in a hospital where a virtual assistant named Kronko has been implemented. Based on the available medical literature and extensive databases with the data collected so far, algorithms have been developed to make a specific diagnosis with accuracy of 92%. The virtual assistant Kronko was connected to the hospital system and had access to all devices on the network. Physicians met this kind of assistant for the first time in the healthcare system. After a few short trainings from IT experts, doctors agreed to test this technology in their daily practice. Devices were installed in waiting rooms for patients to talk to Kronko. After a brief interview and only with a few questions, Kronko could assume, based on the algorithm, the diagnosis and urgency of condition itself. Kronko used data from electronic hospital records also. He also collected the patient's data from social media profiles, connecting with other smart devices from the surroundings. The doctors in the oncology unit used Kronko to diagnose without meeting patients directly. The second scenario about biometric self-monitoring described the use of smartwatches and how the public-private controversy can affect the prioritization of values in a case of value conflicts. The story follows the employees of a private company with a particular focus on the importance of data. Employees received a smartwatch as a gift. The smartwatch had the opportunity to follow steps, heartbeat, blood pressure, oxygen, stress level, and so on. Among them, employees have launched weekly and monthly steps challenges. The company proposed that the data be synchronized with the official computer to monitoring and compare results easily. The employees used watches in different ways and for various purposes. For example, Mia used a smartwatch to record her menstrual cycle, which is synchronized with the application on her computer. During one presentation and sharing screen with colleagues, she accidentally shared information about her cycle and the high possibility of pregnancy. When deciding on her promotion, this information was considered on the company's next board. The scenario method, based on anticipatory ethics, encouraged participants to think about ethical issues of emerging technologies, to draw users closer to these technologies, develop imagination, encourage critical thinking, connect the future situation with the present, and illustrate decisions and hypothetical consequences. Scenarios can often leave open meanings. They are hypothetical and contribute to the quality of data that participants bring to the research. Enjoy our poster and feel free to contact us if you have any questions.